Hi, and welcome to Therapy Tip Tuesday. My name is Miss Madison, and you can find me in the Farmingville or Stony Brook offices. Today we're going to be talking about oral motor exercises and how to get your child to practice. A lot of my patients and their parents say that they have trouble finding time to practice with their jam-packed schedules, and that's understandable. So what I do and what I encourage is to have your child practice before and after they brush their teeth. So this is a way because they're getting those practices in and it's not a huge time-consuming thing in your jam-packed schedule. So the way that I teach my patients to do this is for side to side, so moving their tongue side to side. And some of them may need that tactile cue, so I advise them to use a toothbrush. Like so. And same thing with bringing their tongue to spot. Now, if some of your children or patients have problems finding their spot, you can take the toothbrush and brush their spot and tell them that's where your tongue needs to go. Bring it up there. Okay? And so that's a great way while you're brushing your child's teeth or they are brushing their teeth. The older kiddos, they can use that mirror as their visual feedback to see where their spot is or where their tongue needs to go for those oral motor exercises. This is great to do because you brush your teeth 2 to 3 times a day, right? So it's already in your schedule. So it's great to squeeze in and to make sure your child's practicing, because the biggest thing is we want carryover. So if we're giving your child those practices for these exercises, it's for a reason, right? We want them to practice at home, but we understand that if it doesn't fit in the schedule, so during teeth brushing time, it's a great way to incorporate that. There's other ways that you can do it. You can do it with a lollipop as well. So same idea with the toothbrush. You can bring it side to side. That same idea. So I would encourage the toothbrushing because it's more in the schedule versus a lollipop, and you don't want your child having a lollipop 3 times a day practicing, but totally up to you. So there's 2 options right there to try and elicit those oral motor exercises. They can do it in the car with the lollipop if that's the idea. I had some of my patients use pretzels. So anything that is motivating to your child to do those tongue exercises, to try and elicit them and to continue them, I would definitely encourage it, all right? So it was great talking with you, and see you next time.